Hi, I'm Rose from ScoliCare, and today we're talking about the Cobb angle, what it is and why it matters, and how it helps guide scoliosis decisions. The Cobb angle is the primary way clinicians measure the size of the scoliosis curve. It's calculated on an X-ray by measuring the tilt of the most angled vertebrae in the curve. It tells us how much the spine is bending and helps us decide on treatment decisions. Understanding your Cobb angle gives you a clearer sense of where you are on your scoliosis journey and what the next steps might look like. Now, why is the Cobb angle really that important? The Cobb angle helps classify the severity of the scoliosis and lets us track how the curve changes over time. A measurement of 10 degrees or more combined with spinal rotation is considered scoliosis by definition. Curves between 10 and 20 to 25 degrees are generally considered mild and often managed with scoliosis-specific exercises, and sometimes a nighttime brace is used. Curves from 20 to 25 degrees up to 40 or 45 degrees fall in that moderate range, which is a crucial stage where 3D custom bracing tends to have the greatest impact. Once a curve reaches that 40 to 50 degrees or more, it is generally classified as severe and may prompt discussion around surgical consultations. It is important to remember that even a mild scoliosis still requires attention. It's a mild diagnosis of an important condition, one that can progress, especially if a child has not reached skeletal maturity and still has a lot of rapid growth left ahead. That being said, the Cobb angle is only one part of the bigger picture. Flexibility, age, growth, pain, posture, and overall function will help determine the most appropriate care. Like any measurement, there can be small variations between people measuring the curve. We need at least a degree change of 5 degrees or more for the curve to have considered being changed. That can be getting worse or better over time. Consistent imaging and follow-up with the same trained professional ensures the most accurate tracking and the clearest understanding of how the curve is behaving over time. At ScoliCare, the goal is always to intervene at the right time, before the curve progresses beyond where non-surgical care can be optimized. Many people want to know whether the Cobb angle can improve, and the answer is yes in many instances. With timing and consistent treatment, many patients do experience measurable improvements. Modern 3D corrective bracing combined with scoliosis-specific exercises can help move the spine towards a more balanced position and may reduce the Cobb angle. Although the Cobb angle is important, it doesn't tell the whole story. Clinicians also need to consider age, skeletal maturity, curve flexibility, symptoms, and the posture from the side view, lifestyle, and general function to make clinical decisions. We support the whole person, not just the spine. At ScoliCare, we help patients understand what their Cobb angle means today and how it can change with appropriate care. Thank you for joining me.